Today's call is actually the final one in this small transition series. We've covered transition from incarceration and nursing home transition, youth transition, and we've talked about guardianship and transition. And today's call is sort of a catch-all since it's the last in the series. Feel free to bring up any transition work that you're doing at your center, or any questions that you might have for your peers in regards to transition. And I guess with that, I'll go ahead and open up the floor. If anybody would like to share, what you're doing around transition, or if you are experiencing any barriers that you'd like to troubleshoot with your peers around transition. Would anybody be interested in going first? Okay, Mariah, I see you can't use your audio. So for those who are joining and can't unmic or unmute, feel free to throw it in the chat and we'll catch you there as well. Who would like to share what's going on in your area, what you're doing around transition, all the different kinds, or if you have any barriers you're experiencing you'd like to troubleshoot with your peers? Yeah, I see Lois. Feel free to start us off. Thanks, Lois.
I thought I just joined, so I thought I might as well start if nobody else wanted to share. Transition, the way I look at transitions is there's many different ways to view transition. Not only is it from skilled nursing out to independent living or from youth into independent living, there's other areas like incarcerated being released. And we are working there in that area. And we are also working with clients who have barriers such as being isolated and not having services. So we are working on trying to get them into an area that is more accessible. So there's all kinds of areas in transition. But the barriers mostly in all these is housing. And there's not enough housing for anybody. You can advocate all you want, but you can't get a house if it's not there. And so that's the barrier. Thank you.
Thanks for sharing that, Lois. If anybody wants to share some creative solutions they have around housing during transition, we are all ears. Yes, Rebecca.
I don't know if I actually have anything to share as far as what we have been doing. So I am new to the peer support group, and I am fairly new in my positions. I've only been here since April, and just as Lois said, lack of available, accessible, and affordable housing is a huge issue, and I am looking to kind of promote more visible housing, upping the percentage when public entities are using public funds as part of any kind of project. And I want to know if there's anyone else that has maybe done that within the support group, and how did that go within their community?
Great. Thanks for the question. Does anybody have anything they'd like to share around increasing the accessible housing stock for those using public funds? And did I get that question right?
Yes.
Has anybody done that? Yeah. The question again, she's wondering, she's looking at ways that she can advocate so that there is an increased amount of accessible housing available by adding information in for those who are using public funds to build housing as an avenue to increase it. And she's wondering if anybody else has had success with that. Yeah, Lois.
I just wanted to clarify, I'm not sure what she was talking, I'm not sure what public funds are. Is she talking about the state funds?
I'm talking any funds such as art funds. A lot of counties around here are using art funds as well as municipalities for housing. And the concern's been you would then need to have so many accessible units for providing 1 and 2 family homes. And then whether it's, when I'm talking public funds, I'm talking whether it's federal, state, local tax dollars, and even supporting even bid districts where they're deferring taxes. And again, you're dealing with public funds there. So I'm looking at public funds all the way around.
I see. I wasn't sure about that. I'm in Oregon, and I know that Oregon has, right now they've been releasing a lot of funding for housing projects, and they're working on them. They're in the process. And the other issue is they've been doing what's called home shares. So, but as far as public funds, I have not been aware of any of that. Yep.
I know that there are some states that have worked on this advocacy issue. I'm going to look back through my notes and see if I can remember who they were. For those just joining us, we're talking transition of all sorts. What are you doing in your area around transition that others might be able to learn from? And then we also just had a question about housing being one of the biggest barriers. Does anybody have any tips or tools for advocating for an increased stock of accessible housing, rather through public funds avenues or others? Jamie is mentioning that their county in California is doing home share as a possible option. I don't know, Jamie, would you maybe explain that or expand on that?
Hi, I'm Jamie. Our organization is the Independent Living Resource Center in San Luis Obispo County. We have it's actually called Home Share Slow. It's an organization that facilitates home shares. So they are looking for people, it's typically seniors or older adults who have had children move out or a spouse has passed away and they have extra room in their homes. And they're looking for either an extra income, companionship, sometimes task sharing. And they go through this organization. And then people who are seeking homes or a room to rent are, they put in an application and this organization helps to match and facilitate a home share. And the hope is that it will be a successful match. And I've signed up several of the consumers I'm working with. It's a process because they want the match to be successful. It's slowly growing, but it is an option and it is something that could be temporary while waiting for affordable housing because it is very limited in our area.
Absolutely. Oregon is doing something very similar.
Great, thank you for sharing that. That's an option I hadn't heard about yet. I think, as we try to get more folks in housing, it's a great option. I see Kathy in the chat says that this share program was also rolled out in Bucks County, Pennsylvania. So it sounds like it's catching on. Yeah, Rebecca.
I like hearing this. This is wonderful. And I have to ask, is this either you or Kathy, Jamie, either you or Kathy, if you could let us know if some of those individuals that might be matched up, maybe being matched in a home that is currently accessible until an individual is able to find housing, or has it not gotten that specific? Do you know?
Currently, the consumers I've worked with are still on the waiting list. Again, they're trying to make sure there's a right match. And in our area, a lot of the people seeking a roommate, so to speak, are females, and the consumers I have signed up are males. And sometimes it's not quite the right match. Accessibility features, there's a long form that you fill out, and that's something you would put in there, is that, you know, it needs to be first level, it would need to be, you know, accessible for a wheelchair user or someone who uses a walker. So some places could be accessible or update accessibility features, or, you know, others, it's just not an option, being that they have stairs or other things. So that does maybe limit some availability options if they do need accessibility features.
Thanks for adding. I do think though, talking about the idea of, you know, retirees, or sometimes those homes are starting to become accessible or at least visitable. It's an option. Great. Would anybody else like to share, you know, what you're doing around transition in your area? You know, no matter what kind of transition it is. I know we talk about it. We've talked about it through this series in lots of different ways. Or any kinds of great tips that you want to add for people who might be experiencing barriers to transition. And while folks are thinking and raising hands, I wanted to add that is it Cami in the chat says that this sounds similar in Tennessee. It's called a family model service. Wonderful. What else is going on in transition?
So Mary, hi, Mary, it's Renata. I'll share a little bit what we're doing. We do a lot in regards to transition, but I think one of the biggest things that our center does is our transition program that we have in regards to the youth in the county that we serve during the school year, and we're getting ready to kick that off here pretty soon. We work with high school youth in our county and go out into the community and actually meet with them at a location that we've secured, and facilitate independent living related skills and different types of skills with them throughout the school year. And so it's been great. It's been we haven't had in the past since COVID as many schools as we normally have, but I think now since COVID, of course, COVID hasn't gone away, but it has reduced some, I'll say that. They're wanting to get back involved and start participating, but it's been a really good program, and it's really good for the youth. We focus on various topics and even what to do post high school.
Thanks, Renata, for sharing that. It is, it's back to school time across the country. And so it's a great time to start thinking about youth transition.
Mary,
Yeah, Carol.
hi. My name is Carol and I'm from the Dakota Center for Independent Living. We're located in Bismarck, North Dakota. And one of the things that I will start up, because yes, it is back to school time, but I'm actually able to do a driver permit class at all of the local high schools. Sometimes I'll spend the whole day. There's 2 high schools. I spend the whole day. We work very closely with the North Dakota Department of Transportation, and we use their manual. We go in, divide the book into about 5 different chapters. We have study guides that go with each of the chapter, and it'll take about 6 to 8 weeks, but we go at the students' paces and at least get them to go and look through that book. They get to keep the study guides because, of course, that's just what they are, study guides, for right before they take their permit test. We work closely with our motor vehicle department so that they know if a student needs an accommodation. You don't always have to take it on the computer. It can be read to you. You can still take written tests. And we usually have about 157 kids every year. Many are successful in getting their permit. Sometimes that can be a barrier because to take that driver's license driving test, you have to have a car. You have to have a reliable car, but it's the first step, and it's so important when they are going to go out into the world. Sometimes you have to be able to drive. So it's a very successful and a program that I love.
Carol, thanks for sharing that. You know, I think in all of our peer support series, we hear over and over housing and transportation are big barriers. So that's a neat program to try to help build youth towards that transition to the community. Yeah, Toffee.
Hi, my name's Toffee Webb. I use they and she pronouns. I'm with the Southwest Center for Independence. We're here in Southwest Colorado, and I'm really new to my position. I've been here like a month, but I have been finding that a barrier that I'm facing that I'd love maybe some more experienced folks' input on is motivation. A big part of our, it's like the philosophy of independent living and stuff like that. You really want a person to like want to move through those sort of phases and processes. And so I was wondering if anybody had any tips in the realm of just like generating, building, and maintaining the momentum. I have some consumers who tend to be really feet in the mud kind of about it, just like very, seem to want it, but seem to not have the energy to want it, if that makes sense. So like anything around advice in that realm would be really appreciated.
Thanks, Toffee, for the question. So who has tips on building that self-determined piece when you're working with a consumer on transition? Ways that we can help consumers reach their goals. Mariah says peer support. Absolutely. Yeah, and Lois.
That's what I was going to say too, support. Lots of support, building those skills, and being person-centered.
Yes.
Yes. Good afternoon. This is Sabrina with Life Inc. in Savannah, Georgia, Center for Independent Living. And
Yeah.
I would think about possibly making small goals at first. If you got someone who's hesitant about making goals, try setting some more reachable, attainable goals. Start small and then build upon that. That would be my suggestion.
Thank you, Sabrina. I see some
You're
thumbs
welcome.
up. Yeah, Caitlin.
Hi, yeah, I'm Caitlin. I'm from a center for independent living here in Fargo, North Dakota, Freedom Research Center, and we have started what we call young adult gatherings for ages 16 to 25. We have tried various different times, such as in the morning for the transition students to make it, because that's what they requested. We have tried, we even went as far as doing 5:30 to 7:30 p.m. to see if that can get them going. And we have been finding that they tend to not show after the first few times, and we let them decide what games they want to play, activities, try to get them more involved rather than feeling like they have another class to go to. And I do find that when you have pizza, that tends to get them to want to come. If you provide pizza, they are more apt to come. We tried switching it up with different snacks, so it's not pizza every single time, and they honestly drop off. So I'm hoping to get it back up, but I just wanted to throw that idea out there. We're in the same boat. We're having a hard time with follow through. Even in the peer mentor program, we're having very poor follow through right now. I feel like we're starting new again. So I just wanted to let you know, Toffee, that we're kind of in the same boat, but hopefully that's an idea that you can kind of bounce ideas off from, or bounce ideas from, and just different things to think about as well.
Thank you, Caitlin, for sharing that. I just might add also, I think in my experience, what I'm hearing around the country is that I feel like we also sort of got out of the habit of setting goals and working towards them. I think a lot of us, especially those of us with disabilities, were in survival mode during the pandemic for so long that the idea of following through with even small goals can seem overwhelming. So I don't know if it would be helpful with those, peer supporters, really just walking alongside that person in their goal. So, for example, if it is to maybe ride the bus, having somebody ride that bus with them the first time, and then drop or, just making it feel more doable, especially since a lot of things feel more overwhelming these days after the pandemic, I think, for a lot of folks. And that's just in my opinion. Yeah, Cammie.
Hi, Toffee, I understand what you're talking about, because not only do I have a hard time getting people to get motivated, I, like you said, since COVID, have had the hardest time getting myself motivated for a lot of things. So what I had to do was like put my goal, like what I'm working towards, like on my mirror, like put sticky notes around my house, like this is what you want. You want to pay off your home. You want to be able to do new things. So I encourage people who have goals like that to put just affirmations and tell them that it sounds silly, and the first couple months you do it, even the first few times you do it, you feel ridiculous, but they do work.
Great. Thank you for adding that. All right. We also have a lot of great info in the chat going on, revolving around peer support, inviting people to CIL events, to CIL events, making sure that, we're working with people who have successfully, met goals like that before, so they can learn tips and tricks. A lot of peer support suggestions. I love that. That is something that makes independent living unique, is that we can offer that peer support. Does anybody else want to share what you're doing around transition in your area? Whether it's nursing homes or foster care, incarceration, or youth transition, or any questions you have for the group. Just going through here. And Toppy, I hope that that was helpful. Anybody like to share what you're doing in your area or questions for the group?
Hey, Sabrina again, and I would like to share that the center where I work, which again is in Savannah, Georgia, Center for Independent Living, we have a group of students that we work with too as well, in helping them transition from high school into the workforce. Been during the summer, we had taken time to do and host a few activities, and one was which was going around and doing a beach cleanup. We had some that participated in that, and they enjoyed doing that and being out in the community with people like themselves in the same age as them. So we did that, and we also took them to a musical concert festival that was in the park. So just little things like that was actually allowing them to be social and, you know, just be out and hang out with people among themselves that's the same age as them.
Awesome. Thank you for sharing that.
You're welcome.
Yeah, Lois.
Yes, I just thought I would share. We have a LGBTQA+2 support group for the youth, because we did surveys, and that was a majority of the youth said they had no place to go to feel safe, or their peers where they could. And so we have that peer support group going on for that community. It's good, I think. Thank you.
Awesome. Thank you. We also have a question in the chat if anybody would like to chime in. Mariah says, how do I get people to stay connected and committed to our peer support program? I'm having issues with people dropping out after a certain amount of time. Do any of you have some ideas on how to, you know, retain those peer support folks?
This is Lois again. I agree with the one lady that said pizza, as I have found in my experience, I've been with our organization, our center, for many years, and you have food, and they always come. So pizza and games, and keep it interesting, especially for the younger.
And I like to second that. This is Sabrina again. And yes, food. And we also incorporated doing a gift card, not each peer support, but at different times of the year, we may do a gift drawing for a gift card. And we also do like a social event each month. Peer support, we have twice a month, and it's mainly talking about different topics that, you know, that we are impacted by as people with disabilities. Now, our social club is mainly doing games and fun things, and we try to do that at least once a month, and a lot of it is on Zoom, but we have started recently coming back to the office and holding art projects and just doing things together as a group. And we always have a little snack then, and at the end of it, their name is drawn in not a contest, but drawn to see if whoever win the gift card that we provide. So that has been a real big, something that people look forward to. In fact, we just recently had a movie night, or movie day. We call it matinee, but we did a movie and popcorn and snacks and just share some social time and allow people to get out and mingle amongst themselves.
Oh,
I
thanks, Sabrina.
agree with Sabrina. And we do the gift cards also. This is Lois, I'm sorry.
Wonderful. And I have Cami in the chat saying that as well, that they do random giveaways that they get for donations. And then Caitlin adds that they agree with Mariah's question. It's hard competing with the state's paid peer support specialist programs that are coming up and doing well. Not many people seem to want to volunteer their time once they find out the state pays. But others who do want to volunteer, they sit on our waiting list with no one requesting mentors. I'm hoping to hear suggestions that people share. You know, Caitlin, I know that I'll say this is that I think that peer mentor programs look different everywhere. Some people, you know, if they're not getting matched with individuals, you know, maybe it's just that they're going to help somebody by physically being support. Like maybe it's somebody who will go to the housing office with them to sign up for the housing wait list because they've done that before. And it can be scary to somebody who's never done that. I think the other thing is that I see a lot of centers who will use those volunteers, you know, while they're waiting to be matched, train them up to be community advocates. And maybe it's somebody who is interested in transportation and can sit on your, you know, special transportation board, or, you know, maybe there's a public health committee that they could join and really bring that disability lens to it. So thinking not necessarily, you know, just that one-on-one support that they can provide, but they can provide that peer lens to the whole community while they're waiting to maybe stay engaged. I don't know if that's useful tip or not.
Advocacy support is very important.
Yes, I would agree. Great. Would anybody else like to share, you know, a question that they have for the group that they'd like to brainstorm, or what you're doing around the many different transition topics in your area? We have a question in the chat. What are some topics for peer support? Would you maybe expand on your question when you say topics? Maybe different ways that peer support can be used, or do you mind sharing a little more about your question? What are some topics for peer support? We'll wait. Does anybody else have anything that they'd like to share? What are you doing in your areas around transition?
I'm Darlene. Here in Mountain Horizons, we are trying to get them involved out in the community and with each other, you know, to get them started talking. So we do have our different peer support groups, you know, like our CP group and our senior group and the youth, but we also have what we call Fun Day Monday, where at least twice a month we get out in the community and meet and do different activities. We have our cooking classes for independent living, and then we have once a month. And now we're about to start art appreciation, where we go out once or twice a month and do things with different mediums in the art. So they can try different things out and even work with them one-on-one if they need it. So it's just kind of getting them as well as some of the parents talking. And that's how we're getting them together.
Thanks, Darlene. And I did have in the chat the clarification. They're just getting into this And so they're just wondering what others have been doing around peer support. I think when we talk about peer support, it's so vast. I think when it comes to transition, especially if you have peer supporters who have lived in a nursing home or in a foster care home or come out of the incarceration system and they're volunteers with you, they can really provide a lot of great support, to folks who maybe are trying to transition from that current institution into the community. Just that whole somebody who's been there and done that, being able to really just show them that, yes, this is possible. And then I think, like I said, I think centers can use peer supporters in many different ways. Some of them use them as travel trainers. So people who are really, comfortable riding the bus, they can help other people navigate that tricky system. Maybe it's somebody who really understands benefits and working and how all of that works together, or somebody who uses a personal care assistant might provide peer support to somebody else on how they can really lead that process, how to direct your personal care, give them some tips on, just those life experiences, I think. I don't know if that's helpful, but Michael, I saw you pop in. Did you have something to add? Oh, you're muted. Cami is.
Sorry,
go
no,
ahead.
I'm sorry. I didn't have, I put my stuff in the chat.
Oh, perfect. So Cami is saying that one of their biggest problems when they're doing youth transition is the parents. Many of them are either scared to let go or have become used to having that benefits income to pay the house bills. Does anybody have any thoughts for Cami on, working on that letting go process with parents?
Lois again. If the youth is 18 and older, it's important, I believe, to make sure that that youth knows they have rights as well as the parents. And so it's important to have some boundaries, I guess. I don't know. But I have a client who's the mother and a client who is the son. So there's a lot of mom wants to cross over boundaries where the son is an adult, so I keep saying you have to give them room, to grow. So that's an issue, I think.
Mm-hmm. It really is. I think, this is another great area where peer support is really useful, Cami. I have worked with lots of folks who run letting go peer sessions. So you might use your PTI, which is the Parent Training Information Center at your state, or maybe you just have a parent that is a strong proponent of building up that that youth's confidence in their independence, and having that parent to parent discussion about letting go from that peer process. I've seen that be successful. And then on the flip side, like Lois is saying, really making sure those young people are getting lots of opportunities to learn about and practice setting boundaries and self-advocacy skills. So then they can be pushing on that side while the parent is maybe getting some support from another parent who has already gone through that letting go process. I don't know if that's helpful. What else is out there? I just got off a really interesting call talking about, we've gone through this Medicaid unwinding process. And I know that lots of folks have been losing their Medicaid. I'm wondering, if this is affecting the work that you all are doing around transition, if you're having consumers struggling with that. If that's something you've been working on in your area. Quiet group today. We have a case of the Mondays on a Thursday. For those who just joined, we're talking about transition of all different kinds. This is the final call in this peer support series for this year. So please utilize this time to ask any questions you might have for your peers. That's what we're here for. Anybody? Let's see if we have anything else in the chat.
I'm Darlene. I'm going to go a little bit back to the parent part, only because I am also a parent and my son is a consumer here. And I always try to make sure parents are invited and are definitely a part of our groups or our activities, because I know for me, it took going along and making sure that he was safe. And my son's 26. I know he's grown, but I had to know he was safe before I was able to let go. So I try to build those relationships as a parent and let them know it can happen. And I've noticed that once we get those relationships and once they begin to feel safe is when they will let them start going on activities and outings and things with us and become more independent. But, building those relationships and letting them know that they're safe, that is a big part of it.
Mm-hmm. Thanks, Darlene. I'd agree. I think that the CIL that I worked at, when we were there, we would do a youth group, and then we would have, we could all meet together with the parents and everybody for the first 10 minutes. And then if there were any parents, we would say at this time, if you would like to stick around, then they could go to another room and meet with one of our parent supporters who could talk to them and give them peer support, or they could go home at that point and come back. So we did kind of the taper off method, if you will, Darlene.
No, I agree. I mean, like when we have our cooking classes, we meet at a community center and we set up a table for the parents so they can visit while we're doing our thing in the kitchen, and then we share the food with them.
Awesome. Great. So we've got about 15 minutes left. Does anybody have a transition issue that they'd like to talk about before we close out? I know we talked a lot about youth transition today. Is there anybody who has any questions or anything that they're dying to share about in their nursing home transition or transition from incarceration programs?
This is Lois again. We, at our center, we are purchasing buildings or apartments, and we're renovating. And we're establishing, because we have 13 counties in Oregon, so we're establishing apartments in various locations for some of our clients who are what's the word I want to use? Oh my gosh, who are Pardon?
Who are like trying to transition out or?
Yeah, or transition, or they're already homeless in the communities and they're substance, that's the word, substance. Either alcohol or substance. Or anyway, we're establishing this to, and then we have like a program that they follow if they get into one of our apartments for them to get clean. So that's a transition, and that's a big, I'm really excited about the program because I have some clients that I've gotten into apartments and off the street, so it's good. Anyway, I wanted to share that.
Thank you, Lois, for sharing that. I think that is
Thank
a
you.
really interesting program. You know, we know that that's a barrier for many people into getting into housing. I'm curious. So your center is doing this. Did you set up like a separate foundation, or how are you going about that?
We've acquired different grants with the program.
Awesome.
And so, yeah.
That's great. We've been talking a lot about housing issues. That's one way to go about it.
Yeah, because it's transition and housing.
Mm-hmm. Who else would like to share? We have just 10 minutes left. Questions or something that you're excited to share about with the group? Jamie says, some issues I've run into is finding shelter options for those who entered a skilled facility unhoused and must now be released back to the street as housing is limited and expensive. Oh, that's a very interesting problem, Jamie. So if you go into like a skilled nursing facility while you're homeless, and then when you're released and you have nowhere to go, what does that look like?
This is Lois again. It's funny that that was brought up because just this morning I received a referral and spoke with a client, and she's in skilled nursing. And so I'm trying to help her get situated into one of our apartments. So yeah, it's working out, I think. So it's the same thing.
Sorry.
Hi,
Yeah.
this is Renata. I just wanted to add to that a little bit. I know in our area, one of the biggest, we've had trouble finding shelters for some individuals as well. And I know the biggest problem is because the shelters here are full, and they just don't have the capacity to be able to house them, which goes, you know, and it's different shelters have different guidelines. You know, there's the ones with kids are different from the ones with, you know, just adults and those type of things. But which goes back to just kind of realizing or putting into a greater perspective what a big problem housing is right now. Because if, you know, if the shelters are full, you know, and so that's one issue that we're having, is that the shelters are even full.
Yeah, thanks, Renata. Yeah, Lois, did you have a thought for Renata?
Yes, and absolutely. That was kind of the same issues that we were facing here. And even the shelters, you know, you have to leave at 9 a.m. and you can't come back in until 6 p.m. So even if you're in a chair, you have to go out on the streets through the day in a lot of our shelters. So, and they were full too. So we had the same issues here. That's kind of why we got into the renovating the apartments. And that's, you know, one of the reasons why we got the grants for the apartments. And so now we can, as long as the people have either used substance or been alcohols, or they have HIV, or, you know, they are qualified for our apartments. So it gets it solves many problems. So, but yeah, we have the same issue. Thank you.
Wonderful. Yeah, Jamie.
That is an issue we're running into, is lack of housing that's affordable. And one nice thing that we do have is one of the shelters has a recuperative care program that I believe there's 6 to 8 beds. So that's very limited, but they, with a referral from a hospital or a skilled nursing facility, they can be guaranteed a bed with a current doctor's note. But again, beds are limited. There's a nightly lottery. So I'm just having a hard time finding shelter in general for those who will be discharged back to the street.
You know, I'm curious, for those of you who are in managed care states, if this is something that we could talk to the managed care programs about. I know I had heard from one of the managed care organizations that they had done a pilot program in, I think, California at one point, where they were offering a space that you know, people who were unhoused could go to, who had like medical conditions, where they could really recover and get control of their medical needs in a healthy environment. And how that really, you know, at the end of the day, decreases our healthcare costs. And so I don't know if that's something that, you know, collectively, if you're in a managed care state, if you could approach folks about, if that would be something they would be willing to maybe partner on. I do just want to throw out there again, you know, this is the last in our mini ILNet transition series for this year. And so if you all don't mind taking some time to fill out an evaluation, give us ideas for next year. Let us know if you were able to get any nuggets of wisdom. We are getting ready to start building out the next proposal, and want to make sure that, you know, folks know whether or not peer support calls were useful and something that we'll continue to do. I'll throw that out there in the link in the chat and in the follow-up email. And since there was a little bit of free time, I just wanted to throw out there, I threw in the chat the link to the April Youth Coordinator Connect call. Somebody asked in the chat about a peer support group for those serving youth. And then I also threw, oh, I'm sorry. I also threw in there a link to our conference. So April's having a conference in October, which is why we're starting to end these peer support series so that we can conference up. So hopefully we'll see some of you there. Does anybody have any last questions that they have in our last 5 minutes that they want to share? Or something that they'd share with the group?
Well, I'd like to make a suggestion. When you say that you have homeless shelters that let you leave early in the morning, that you're not allowed to be there. In Savannah, we have found out that a lot of the local churches have opened their doors to have them have some way to go instead of just being on the streets. But they service them by providing enclosure out of the heat, and have opportunity to get help or make phone calls if they need to, and just a place to stay until they're able to go back to their shelter later on that evening or that nighttime or whatever. But just a safe place, mainly for the elderly and people with disabilities who are homeless at that time. And it was one church that did it in particular, and another church heard about it. So right now there are like 3 or 4 in the area that is geared solely for that, providing a place for people who are homeless to come doing it throughout the day.
Great tip to close us out with. Thank you, Sabrina. I think that's wonderful.
You're welcome.
I think a big part of the work that we do at Centers for Independent Living is building those communities,
Yes.
resource mapping, finding out what's available and helping people find it. So that's great, you know, thinking about our churches and, you know, I'm wondering if maybe even it could be something to talk with schools about. I wonder in the summertime if that would be an opportunity to put together some, you know, activities at the school during the day. Maybe folks could go in there. You could have staff from your Centers for Independent Living and help, you know, people sign up for benefits or housing wait lists. I don't know. I was just another.
Good idea.
Yeah. Great. Well, I can't believe how fast these go. We have time for one more comment if anybody wants to make it before we close out.
I think it was wonderful to hear the sound of a little one during our phone call. Thank you.
Thank you, Carol. Thank you, everybody, for your flexibility. I am another shortage that we don't talk about is daycare. I work from home because we are unable at this point to access daycare. So I appreciate all of your flexibility. Thank you, everybody. And I hope you have a great rest of your week.
I think she said bye-bye.